Welcome. Hi, I'm Dr. Fred Salvatoriello. Welcome to this segment of Your Oral Health. It's a program that we developed to try and be instructional, educational, and helpful to our viewers in judging their own oral health and the needs of those that they love. We're especially delighted to have with us an allied dental health professional, Nancy St. Pierre. Nancy is a public health hygienist, attended Keene State College, graduated New Hampshire Technical Institute with her hygiene degree, and is now integral to the program that has been school-based, set up in the Kearsarge and the Newport school districts under the name the Rock Dental Clinic.
That's right.
I think. Nancy, certainly instructional, educational advantages that this program will afford those youngsters in those school systems. Tell us about this program. How did it all come about? This is somewhat exciting and unique and a good role model for other communities. Tell us about it.
Well, in the spring of '94, the Practice Act in New Hampshire changed, which allowed a public health hygienist to come into effect. And at the same time, the New London area had a group of health professionals that saw this need in the community. And they did some surveys, they did some screenings, and they found that, yes, they were in definite need of having a school-based dental program to allow children that do not have access, whether it's through financial or transportation. You know, when you have both parents working, it's difficult to get your child to the dentist every 6 months, and having a school-based dental hygiene program was the whole solution to the problem.
That's excellent. Tell me what communities are served within the Kearsarge district.
There's New London, Warner, Bradford, and Sutton. Those are the 4 schools that I will be attending and doing screenings and prophies in. And then in Newport, as you have said, the Toll and the Richard School.
Screenings and prophies, you're going to be assisted by a dental professional at times during that process. We're going to be screening these children for dental decay, dental disease. Is that correct?
Both of those. I'm in hopes of having volunteer dentists come in or hygienists come in and assist me in the screening process. And the screening, this program is a 2-phase program. There's a screening offered to all of the students of grades 1 through 3, and that is to diagnose or observe any dental disease, whether it's decay or inflammation, poor oral hygiene, orthodontic issues, retained deciduous teeth, which are baby teeth, permanent teeth that are not erupting properly, or permanent teeth that can't erupt due to space problems. And then the second phase is the actual prophy phase, and that will be geared to students that are high risk, students that don't have a dentist, that have a very high plaque index or have a very high decay that we observe through the screening process.
So that, in other words, a prophy for listeners would be short for prophylaxis.
That's
that would
right.
be a cleaning.
That's right.
This is, of course, is totally voluntary. These students are not mandated to do this. This is strictly a service, and a wonderful service.
That's right.
A badly needed service, particularly in some of the communities you've mentioned. Totally optional. Permission will be granted in writing from the parents? From the parents.
The parents receive a permission slip that is sent home through the school. They sign the permission slip, and they also fill out a medical history form so that I am informed as to any medical problems that the child may have before I do a prophy.
Equipment, supplies, is this taxpayer supported, or where did the funds come from to start this program?
The first year funding came from the New London Hospital and also private donations. Allison Rock Pittman and her mother both donated personal funds, and that's where the name of the clinic came, the Rock Dental Clinic. Her father and grandfather were both dentists, and that's where the name came from. And we're in hopes of receiving more private donations and grants so that this program can continue, plus hopefully expand and be able to have more grades, more students be able to be involved.
Other communities could follow your lead.
Yes, they could.
Communities could set up the similar type programs with you as the model, wouldn't
Yes.
have to reinvent the wheel.
That's right.
You're a resource person. We're going to encourage our listeners to contact us either by phone or by mail.
Absolutely.
You can supply them with information to sort of facilitate their community setting up a similar program.
Absolutely. I'd be happy to help anyone that is looking into trying to do something like this in their own community.
Nancy, you mentioned about private funding of this project. If there were a viewer who wanted to contribute to support of this program, there will be a mechanism for that to do, and you're encouraging that type of participation. Is that correct?
Absolutely. Absolutely.
Okay. We'll be providing throughout the program an address where if you recognize and want to encourage this kind of community-based support, where the rubber hits the road, right where it needs to be done the most, we'll let our viewers in on where they can send that information, as well as inquiries that solicit Nancy's assistance. Nancy, I want to thank you for coming today.
Thank you.
I really appreciate you being here, and I applaud the community and the efforts yours individually and collectively in taking the leadership position really in this age. It's something that I think we need to do that as a profession and as individuals, and I commend you
Thank
for
you.
it. Thanks
Thank
for
you.
being with us. Hi, I hope you're enjoying this program. If you have a question specifically for one of our guests, or a suggestion for a future show, or someone you'd like to see here on our program, you're encouraged to call us at 1-800-SAY-SMILE, 1-800-729-7645, between 8 a.m. to 5 p.m. Monday through Friday. Or, if you prefer, drop us a note at Your Oral Health, Box 915, Hanover, New Hampshire, 03755. Welcome, Dr. Fred Salvatoriello, Your Oral Health. Our guests here with me are Dr. Elaine Hatch, restorative dentist in West Lebanon, Elaine. I always get
Yes.
Lebanon and West Lebanon
West
mixed
Lebanon.
up, forgive me. And Dr. Robert Alvarenga, who's a periodontist, specialist in periodontics. Little background on Elaine, and I'm particularly delighted to have Elaine here, being somewhat partial to the ladies. We're nice to have her here with us. And I'm particularly impressed with Elaine's background, a graduate of the Northeastern and Forsyth School of Dental Hygiene, and then did a career shift and went on to dental school, a graduate of Tufts University, like myself, in private practice in Massachusetts, and happily for us and her patients, now here in the Upper Valley. Welcome, Elaine.
Thank you.
Dr. Alvarenga, Robert, has a graduate of Rutgers University. We were sort of doing the fight song. I happen to have gone there myself, but we won't say when, Bob. Okay. And then went on to New Jersey College of Medicine and Dentistry in New Jersey, and then did his graduate residency at Columbia University in New York. Nice to have you with us. Elaine, noticing, looking back, and I said I wouldn't say how long ago, and I won't, very few females in my graduate school class. Great to see the female population in dentistry specifically. Medicine was always, I think, a little ahead of us. Great to have your participation. Is that sort of true? Do you find that, that this is an excellent career choice for a young woman these days?
Oh, absolutely. Dentistry is a great career for women. It fits in very well with home and family. You can pretty much set your hours. It does not have the time demands on it that, say, a physician would. Mm-hmm. So you can be where you want when you want, pretty much. It's a wonderful career.
Mm-hmm. Well, I hope that those ladies that are watching and are thinking about futures and careers might take heart in the fact that you can have the best of all worlds.
You can, yes.
And have family and a career along with a support structure, of course. Dr. Alvarenga, as a periodontist, and we want to spend some time in our segment talking about periodontal health, maybe you could define for us what a periodontist is. What specifically does that mean to our viewers?
Well, a periodontist is a dentist. He's a specialist. He specializes in the treatment of a disease known as periodontal disease. It's commonly known as gum disease and has been traditionally known as pyorrhea.
The incidence of pyorrhea gum disease, probably the most prevalent disease on the face of the earth, would you guess?
Well, if you call it gum disease, it tends to be more encompassing, and I would say at this point 80% of all adults have some form of gum disease, but a very mild version of it.
Mm-hmm. Elaine, advice you give to your patients, and perhaps you see the incidence and the incipient early stages of gum problems.
That's right.
What kind of advice do you give a patient, not just with gum disease, but how do you get good dental health? What do you tell your patients what they can do to help themselves toward a good dental future?
I try to impress on them the importance of good daily home care. Brushing at least a couple of times a day, flossing daily is so incredibly important to the long-term health of the gums and the underlying bone. Also, not to be taken lightly certainly, is good diet and nutrition. Good dietary habits play a very important part. And I urge people to please read labels when they shop. It's amazing how much sugar and additives are in foods that we really don't realize unless we really study those labels, and it's really important.
So really something as simple as just turning that object over
Exactly,
in the shopping mart and
exactly.
looking at what those ingredients are is
Right.
really kind of where it starts, because it's what you put into your body as to
We
your
are what
body
we eat,
becomes.
yes, exactly.
that saying.
Yeah.
Gum health begins in the home front, but really is, and Bob, I think you can support this, really starts with a general private restorative dentist's office. Would you agree?
Absolutely. I think that the general dentists and the people working for the general dentist, including the dental hygienists and assistants, are perfectly qualified to recognize and treat most forms of periodontal disease.
Mm-hmm. The kinds of problems that patients would develop, are these problems that are reversible at some point, perhaps in the early stages? We've talked a lot
Yes.
about prevention, reversibility of certain dental diseases. Do you find patients motivated to do that?
Pretty much so. If we can get them in and identify the problem and talk to them about it, educate them about it, when they realize how really simple it is to turn it around just by these simple things I just mentioned, it does well. They do well with it.
So education really is just at the heart of everything that we
Exactly.
do. I mean, I don't know many professions outside of the healthcare professions that try so hard to basically eliminate their economic viability. When we come back, I want to talk more specifically about signs that you might be able to recognize in your own oral condition that would help you learn about the importance of brushing and flossing and diet, and we've got two experts here that are going to help us do that when we come back. Hi, and thanks for joining us today on Your Oral Health. Thanks also to your local cable access network for giving us the privilege of bringing this to you. Local cable access is your television. It's community television. It's your friends and neighbors. So support it whenever you can. Welcome back. We're here with Dr. Elaine Hatch, a restorative dentist in West Lebanon, Dr. Robert Alvarenga, periodontist specialists. I want to mention that Robert has offices in West Lebanon as well as Claremont, New Hampshire. In the break, Robert, we were talking about physical appearances of periodontal disease. Do you know you have it? Do you know you're going to get it? Can you feel it? What does it look like? Can you give us some simple kinds of tips that we can look at as...
Well, I think the one of the problems with periodontal disease is that self-diagnosis or diagnosis by the patient it can be very deceptive. Typically, it's referred to as gum disease, and there are many patients that I see that come to my office and their gums look great. They have no bleeding. In fact, by the time they see me, they're usually brushing very well, flossing very well. I imagine they begin that the minute they're told to see me. So to rely upon the appearance of the gums, whether it bleeds, can be helpful, but in most cases can be deceptive. Periodontal disease doesn't fit the criteria of a typical dental disease. You usually don't feel it.
Sort of like being sent to the principal's office, I guess. Got it.
Sometimes patients see it that way, of course, in the waiting room.
Elaine, what type of dental aids? You look in the dental aid section of the local pharmacy or mall store, rows and rows of different kinds of dental aids. How do we become knowledgeable dental purchasers of dental aids? How do we pick and choose? And what do you recommend for your patients?
As far as toothbrushes go, I recommend a soft-bristled, straight-head brush, which actually I give to all my patients at the time of their cleaning appointments.
You actually give a brush to each
Yes,
of
I
your
do,
patients.
and I also give a sample of floss. Unwaxed is the preferable type of floss. But for those whose teeth are very tight together, have large restorations, and the floss wants to shred, certainly a waxed floss is preferable to not flossing at all. Not just the brush, but the way it is used, it's really important. I see people who come in who say, but I just brushed, and yet all along the gum line you can find plaque and debris. So it's important to make sure that you feel the bristles of your brush getting around your gums too.
So it's really the quality.
Exactly,
The quantity,
yes,
particularly
yes.
with young people. I know
Right,
it's a real hard
right.
concept to get across. I oftentimes say to patients, well, I recognize that you brushed your teeth. Everybody brushes their teeth, but you didn't clean your teeth. We want to educate you to know the difference.
Right.
What about other kinds of things, such as a water pick or other stimudental kinds of things where things can go in between?
Right. Those used correctly are very good, the stimulants and those sort of things, but you want to make sure you get instruction from your hygienist or from your dentist before using them. Water picks are fine with orthodontia cases. You've got to get around, around braces. If there are bridges that the patient has that are catching food, it's fine for flushing, but it does not remove plaque. Plaque must be removed by brushing or by flossing. It's sticky, and the water pick does not take the plaque off.
Okay, so plaque is really the enemy in basically almost
Plaque
all
is it.
dental disease.
That's where all the
decay as
bacteria
well.
is, yes.
Bob, you've brought some good illustrations here, and I think it's important when you talk about an unhealthy disease state that we know what healthy may look like, and you've done a nice job in explaining that to us. If we could take a look at some of the things that you brought, it might help our viewers understand not only the appearance, perhaps, which, as you noted, is not necessarily obvious, but also radiographically what actually happens during the disease state. If we could kind of share those.
Well, Fred, I warned you that I would be bringing some pictures here today. This is an illustration of a child's mouth in a healthy condition, and this is an adult mouth. Now, it's obvious that the gum is very pink and healthy. The thing to keep in mind, though, is that I have had patients come to my office that have severe periodontal disease and their gums look like this. So you can't always count on the superficial condition of the gums to look this healthy. The other thing to keep in mind is that the mouth is loaded with germs. There are thousands and thousands of germs, even hundreds of species of germs. And the germs live in the saliva, they live on the tongue and the cheek, and they land on the teeth. When the germs land on the teeth, this is what we refer to as plaque. And here's an illustration of, this is quite a mouth loaded with plaque here. You can see this film around here, but plaque is not always visible. The other mistake many times patients make is they mistake plaque, which is soft and many times invisible, with tartar or calculus, which is something that has to be professionally removed. This stuff has to be removed by this patient every day. And the fact that the gums are so swollen and red suggests that the plaque has been here for 2 weeks at least. Okay, so this is the early stage, which most people are familiar with that term, gingivitis. At this point, it is a reversible disease. If you get your teeth cleaned, if you learn to brush and floss, you can be right back to that original picture right there.
Okay, so Bob, if I might just
Sure.
interject, this type of a mouth is easy for anybody who looks in the mirror to sort of make an assessment about.
That's right.
It's important that our viewers understand that you can be your own best aid in diagnosing your own problems. Motivation to do something about these problems, that's yet to come, I guess.
Well, that's right. That's exactly what happens. In the early stages, you can see it. The problem occurs when we get to the more advanced stages, is when a patient suddenly starts to brush and floss well, and they create this superficial health that I originally showed you, and then they can be fooled. This is an advanced stage. Now, you'd have to be blind not to see this. This patient here, these are x-rays. This is kind of a schematic of the x-rays, and this is what you see. These are the teeth, and this is the level of bone here. This level of bone used to be up here. So this patient has lost almost half of their bone. And this is an illustration of the bone being eaten away here. As the bone is destroyed by the infection, these spaces appear. We call them periodontal pockets. These spaces represent sites that are completely beyond a patient's reach. It would be like trying to clean out a 10-foot hole with a 1-foot pole, essentially, and the pole being the brush and floss. But this patient at this point can suddenly get very serious about their brushing and flossing, and they can create superficial health and feel comfortable. You won't feel any pain. But in fact, you'll have this infection that will continue here. You know, it's funny about periodontal disease. We accept the concept of painless illness in the body. Everyone's afraid of hypertension, cancer, what have you. But in the mouth, we tend to feel if there's no pain, then it's not bothering us. And this is a perfect example of a painless illness that can certainly bother you because you're losing bone.
Elaine, let me ask you, a patient like this is new to your practice. You haven't seen them before. They haven't had the best instruction or the greatest motivation, the proper guidance. What do you tell a patient like this? How do you handle a situation like this in your office?
After doing the exam and the x-rays, I put the x-rays up on the viewer for the patient to see and explain to them, just as Bob has explained, where the bone was originally and where it is now, and how we have to get these areas cleaned up. But it is still not going to allow this person to get deep enough to keep things cleaned out. So I might do after a superficial cleaning, do some root planing, and at that point refer that person perhaps to Dr. Alvarenga for some further evaluation.
Okay, so you would do a cleaning, getting off the debris, the parts that can be easily reached, and then do root planing, meaning that the roots of the teeth would actually
yes, we'll
be
get way
sort
down, right, with
cleaned
anesthesia,
out,
yeah,
simply
with
because of-
Novocaine we'll go down, and of course, you know, enforcing home care, good brushing and such at the same time.
So even for a patient with a debilitating advanced gum disease, there is still hope, and it's never too late for some patients. Obviously, there comes a point of
There
no
comes a
return.
point, yeah, there does.
You know, there's a saying in my office that I like to quote to my children also, and that is, you don't have to floss all your teeth, just the ones you want to keep. We'll be back with some additional facts in just a moment. Making dental choices can be difficult. We'd like to help. If you'd like a free brochure entitled Dental Decisions, Making the Right Choices, published by the American Dental Association, you can call us at 1-800-SAY-SMILE, that's 1-800-729-7645, or write us at Your Oral Health, Box 915, Hanover, New Hampshire, 03755. Elaine, some of the things that we hear about dentistry that have been blown out of proportion by the media really sort of make the hair stand up on the back of your neck, and the public really is badly misinformed because of those kinds of things. One of the buzzwords in dentistry that really chills the heart of the strongest individual is root canal. Maybe you can demystify that a little bit for our viewers. Tell us a little bit about what exactly a root canal or endodontic therapy is. It might be more specifically entitled. What about it? What does it do? What is it like? Is it as bad as it seems to be when you see it in the movies?
A root canal is treatment of infection inside the root of the tooth. If you think of the root as an ice cream cone, granted many teeth have more than one root, but for simplicity's sake, it's an ice cream cone and it's filled with soft tissue, which includes the nerve and the blood vessels that feed the tooth. Occasionally, this tissue becomes infected, usually through deep decay. The bacteria in the decay gets into this nerve, and it sets up an infection. It could be from a blow to the mouth that causes this. Whatever, the tissue becomes infected. At this point, the only treatment is to remove that soft tissue from inside the root, which is what root canal therapy does. We just remove all that soft tissue, and then when we have a nice, clean, empty ice cream cone, then we fill it with the material that we're able to pack all the way down to the tip of the root up. At that point, the tooth should be capped in order to prevent any further damage to it, and the tooth is now a healthy, functioning part of the mouth. Root canal therapy essentially is painless. Usually afterwards there is little to no discomfort at all. And it's unfortunate that root canal therapy has such bad reputation because people will opt to have a tooth removed rather than have the root canal.
So a root canal, and I have to say that I chuckled when you said filling the ice cream cone with ice cream, because I know what flavor of type ice cream I'd fill it with. So a root canal basically allows the tooth to be saved.
Yes.
The tooth can be retained by the patient, become functional. You take out the diseased portion of the tooth, fill it with an inert material, and then try and preserve the tooth to structurally create new integrity
That's
for
right.
it. Bob, is it possible that gum disease could cause an internal problem with the tooth or vice versa? Is there a relationship between the diseased internal portion of the tooth and the diseased external portion of the tooth?
Well, you know, Freddie, even though we have our own specialists in our profession, the mouth is a very small environment. And these problems are so close to each other that it makes common sense that there is a relationship. Certainly if there's an infection inside the tooth, it's going to have some kind of effect outside the tooth simply by proximity. We're talking about 3 or 4 millimeters, less than 1/4 of an inch. But the most common way this occurs is if periodontal disease, for instance, causes a significant amount of bone loss around a tooth, and we're talking about loss of the jawbone from the infection, many times it can find other portals of entry inside the tooth and can create an infection inside the tooth. Conversely, if you have an infection inside the tooth that spills out into the bone underneath the tooth, it will eventually find its way to the surface. And then you have what we call a combination endodontic periodontal lesion, which can be very complicated to diagnose, let alone treat.
So that the recognition of the fact that there may be an isolated problem in one area doesn't necessarily mean that it'll stay in that area, and that the potential infection may spread to adjacent areas from either inside or outside, and one may be the culprit leading to the other.
Yeah, although I'm a little bit uncomfortable with the concept of spreading, I like to think of it more as guilt by association. You know, these places are so close to each other. Certainly people have asked me if periodontal disease spreads, and I don't know if that's an appropriate term. But yes, you can have an interrelationship between the inside and the outside of the tooth.
I see. Elaine, in the general scheme of things dentally, what advice, and again I commend you specifically for the courage you took to make your career change, what advice would you give our young female viewers in terms of how to find out more about dentistry as a career, dental hygiene as a career, public health hygienist? Where do they go for that information? Where can you send them? Perhaps their career guidance counselor.
Yes, that's a good source. They can also talk to women in the field.
Okay, and you'd be happy to answer those
absolutely,
questions.
sure.
Well, there will be an opportunity for our viewers to call or write to the program and let us know of their specific interests, and I know you'd be only too happy.
I'd be very
respond
happy to talk to them or answer a letter, sure.
I want to thank Dr. Elaine Hatch, a restorative dentist from West Lebanon, Dr. Robert Alvarenga, periodontist specialist.
Thank you.
West Lebanon and Claremont, for joining me today. We're extremely fortunate in our professional relationship to have caring, sensitive practitioners like this with us, and I greatly appreciate your willingness to come and spend time with us in this discussion. Thanks so much.
My pleasure. Thank you.